Hi, let's see an NCLEX RN video based on fluid and electrolyte management. The nurse correlates this physiological response to the secretion of natriuretic peptide hormone. The options are increase in urine output, increase in blood pressure, increase in blood volume, increase in serum osmolality. When you think about natriuretic peptide hormone, you have to keep in mind why this hormone is released. This hormone is released when the blood pressure is more or when the blood volume is more. That is the reason for the release. And it is released from two areas. If it is released from the walls of the atrium, it is known as atrial natriuretic peptide. And if this hormone is released from the ventricles of the brain, it is known as the brain natriuretic peptide. And the response of this hormone is it will increase the urine output, and that too that is high in sodium. So when you are again going through the question is asked, what is the physiological response to the secretion of the hormone? The answer is increase in urine output. But when the question is asked, what is the reason for the secretion? It is increase in blood pressure or increase in blood volume. Second question, certain conditions that increase and decrease serum and urine osmolality are given. Drag and drop under the correct column. The conditions are diabetes mellitus, hyponatremia, glycosuria, glomerulonephritis. So where we need to put these conditions are increase serum osmolality, decrease serum osmolality, increase urine osmolality, decrease urine osmolality. First one, diabetes mellitus. Diabetes mellitus, you know that it is a condition in which there is hyperglycemia. That means the level of glucose in the blood is more. That is, blood means it is related to serum. And also osmolality means the number of solutes in the blood or urine is more. That is known as osmolality, the number of solute. So increase in serum osmolality happens with hyperglycemia, that is diabetes mellitus. Then hyponatremia, if you are seeing, the concentration of sodium in blood is less. Serum, that is related to blood. Decreased serum osmolality means the concentration of solute is less in the blood. Hyponatremia will come under this. Increased urine osmolality. So third one, glycosuria, if you are seeing, in urine glucose is more. So this is related to increased urine osmolality. Fourth one, glomerulonephritis. In glomerulonephritis, most of the waste materials cannot be removed through the urine, so that results in decreased urine osmolality. I would like to add two more points. Whenever we are collecting blood or urine specimen for assessing the osmolality, we have to collect it at the same time to get the correct value. And the normal range of serum osmolality, it is near to 300 milliosmoles per kg. And if you see the normal value of urine osmolality, it is 50 to 1200 milliosmoles per kg. So increased serum osmolality happens when the amount of serum or the blood part is very less compared to the solute. The solutes are more. In the case of dehydration, sepsis, fever, sweating, burns, you know that time the water level in our body is less. Diabetes mellitus or hyperglycemia, the sugar level is more in the blood. Diabetes insipidus. In diabetes insipidus also, what happens is the number of solutes is increased in diabetes insipidus. In uremia, the waste products are more in the blood. Hypernatremia, sodium is more in our blood. Ethanol, methanol or ethylene glycol ingestion. When alcohol is ingested, what happens is more fluid is gone through dehydration and more solute will be there in the blood. Mannitol therapy, that is a diuretic that results in more release of water from our body through the urine and solute will be more in the serum. Decreased serum osmolality happens with if we are drinking more water, the osmolality will be decreased, the number of solute will be less. SIADH, syndrome of inappropriate antidiuretic hormone. In SIADH, more water is retained in our body and that will decrease the serum osmolality. In renal failure also more water is retained in our body. Hyponatremia, the level of sodium is less in the blood. Increased urine osmolality happens with dehydration, SIADH, adrenal insufficiency, hypernatremia, glycosuria, high protein diet. In all these cases, more solutes are present in the urine. And the cases like excess fluid intake, diabetes insipidus, acute renal insufficiency, hyponatremia and glomerulonephritis, all these conditions in the urine, the solute concentration is less. That result in decreased urine osmolality. Third question, the nurse asks for which clinical manifestation in patient with dehydration. Select all that apply. Options are increased urine specific gravity, increased serum blood urea nitrogen, increased serum osmolality, decreased serum osmolality, decreased blood urea nitrogen. You know that in dehydration, the water present in our body is less and that will result in increased urine specific gravity. The amount of chemical substance in the urine is small or is more compared to the fluid. So that is one answer. Second one, increased serum blood urea nitrogen. The amount of this chemical substances or urea and the end products of the protein breakdown, that is more in our blood through when dehydration happens. And also serum osmolality is increased. The solute concentration will be more in our body with dehydration. Hope you understood this video. Thank you so much. Please do subscribe for more videos.